Hey everyone, it's Dr. John Burroughs at Springs Aesthetics. I wanted to quickly share a upper and lower eyelid blepharoplasty from a patient I treated from Hawaii. She had some unique special requests for her cosmetic surgery, and one of them was that when she was younger, her eyes were more open, and as she had gotten older, in addition to the crepey baggy, kind of fluid, swollen appearing lower eyelids, she had wanted her eyelids to be more open, to look more refreshed. So you can see with this heavy skin, she felt like that was, causing her not to look as alert, kind of a sleepy, um, unattentive look, and she wanted that changed because that was not her inside personality and that wasn't the look she was trying to convey. So her goals were to maintain good brow positions, which is a nice feminine characteristic, maintain a nice arch to the brows. She wanted the extra skin out of the way and wanted the eyelids to look much more symmetric one to the other. She also had a deep sulcus in this left upper eyelid area, right on the screen, but left upper lid, and she wanted that to blend more smoothly like it did on the right side. Now, as you look at the lower lids, her concerns were the dark tear trough deformities here, and this was causing kind of a dark discoloration, a shadow effect, and she had droopy excess skin of the lower eyelids as well as some fat that had been herniating forward. So, to address these issues, this requires, as almost all of my eyelid surgeries, a very individualized, customized approach. So, what we did to help achieve her goals was an upper blepharoplasty to address the excess skin, to address the inner canthi areas that she was wanting to look more symmetric. We took out some fat in a portion and then released some fat to help them look less hollowed or sunk in. Same thing for her sulcus deformity. There are little areas of fat in the anterior orbit that if there's too much, you can address it by sculpting it or repositioning it. And that's what we did in her case, is I released it and then repositioned it. She acquired her platform show again, and she had nice improvement to her crow's feet area. Underneath, she had some excess skin removed. She had some resurfacing of the skin with radiofrequency microneedling, and she also had some fat removal with some fat repositioning as well. To keep her brows from coming down, I missed saying this, the brow fat pads that we all have underneath our brow tissues, the brow fat pads were pexied or reattached, stabilized above the orbital rims, and that helps the brow tissues not come down, or you can even raise them just a bit when you're doing an upper blepharoplasty incision. If you don't do this with the brow fat pads, usually what you're going to see is the brows are going to come down, and that's an aged masculine look and not what she was looking for. So you can see her after results. You can see a lot of improvement in the rittids and crepey appearance. The grooves are remarkably improved underneath here. And you can see she's got platform and improvement with both upper eyelids and a nicely maintained brow positions with a nice feminine arch peaking at that inner 2/3 and outer third junction. Here you can see on the oblique views that remarkable improvement. You can see if you were to see this lady at the library or a store, she just looks a lot younger. So if you hadn't seen her in a while, you'd be going, hey, what's going on, when you see her like this from where she had been before. You can see that that crepey skin is a lot smoother with the conservative skin removal and the Morpheus or radiofrequency microneedling we did. A lot of patients do well with CO2 laser under the eyes, but more of the lower skin pigmentation types. She had Latino in her, and they're at a higher risk for change of the coloration when you use a carbon dioxide laser. Now, because she lives out of state and had come in for this, I would have liked to have done just a little more radiofrequency tightening in that area, but she's very pleased and will let me know if that bothers her down the line. But overall, very happy we achieved her goals, and she was glad she underwent the upper and lower cosmetic eyelid surgery. So I hope everybody's doing well. I hope this was a helpful discussion. Everybody have a great day, and thank you.